think we want to do all we can, certainly, to prevent any kind of unintended consequences from whatever we do here legislatively. So thank you for your input today. Thank you, Mr. Chairman.
Representative Swidler.
Thank you, Chairman Oliver. Doctor, I'm a bit surprised by some of your testimony, but I appreciate your courage for coming forward as a member of the medical profession. I have great respect for doctors and emergency physicians. Doctor, I have some information that seems to seriously contradict your conclusions, and the first one is from Dr. Robert DuPont, former director of the National Institute on Drug Abuse, and he was also the drug policy advisor under Presidents Carter, Ford, and Nixon. And I'll quote him by saying, and this legislation does permit smoking of marijuana, and he clearly indicates, quote, marijuana smoke is known to contain harmful chemicals which adversely affect all body systems, from the brain and the immune system to the lungs and the reproductive system. In addition, I have documentation as part of the record that it may actually make sick people sicker and healthy people sick. It may cause carcosis sarcoma in people with AIDS, and it has nearly 500 potentially harmful chemicals when smoked. And every paper I've read about smoking marijuana seems to contradict your conclusionary remarks as a physician in that inhaled marijuana is associated with higher concentrations of tar, carbon monoxide, and carcinogens than even cigarette smoke. Adversely impairs the aspects of lung function, causes abnormalities in the cells lining the airways of the upper and lower respiratory tract, and in the air spaces deep within the lung, and it causes cancer. Cellular abnormalities and consequences. Contaminants of marijuana smoke are also known to include certain forms of bacteria and fungi. And that makes one susceptible to more infectious diseases. Also, again, I'm reading from the medical community. Smoking marijuana can cause intoxication, precipitation of anxiety or acute psychotic reactions, orthostatic hypotension, and bronchial inflammation. I could go on and on. I'll just finish very quickly that marijuana smoke has ammonia levels 20 times higher than tobacco smoke. Marijuana has hydrogen cyanide, nitric oxide, and aromatic amines at 3 to 5 times higher than tobacco smoke. And we all know tobacco smoke can kill. And if the medical community is saying this has many more times higher those chemicals, how can you say and reach the conclusion that you have on smoking marijuana?
Okay, there's quite a bit in there for me to answer. I'll try and sort of...
You'll have to be brief as possible.
Okay. First of all, the first part of your comments came from the political realm. And just as we talked a moment ago about you need to look at where the sources came from, that's a political statement. And I would hesitate to...
Dr. DuPont of the Harvard MD.
Yes, functioning in a political realm and the reason I say that is because a lot of the things that he said are simply untrue. There are now probably 40 years, I would say, of people who have been smoking marijuana probably pretty regularly that we can look at. And there's nothing to suggest that they have a higher rate of cancer. there is nothing to suggest that any of the things that you've quoted, okay, are significant clinical concerns. And in terms of you talk about these substances which, by the fact that they're grouped together as hundreds of compounds, shows how little we know about them. And to suggest that you know what the effects of those are, either singularly or together, is absent any science. There's no science in that. And most of the people who make the statements about deleterious effects are speaking anecdotally. They're speaking from populations that are not the populations that we're dealing with. Again, there is a fair amount of research that has looked fairly carefully at this stuff, and what they do is they bring up questions, but not conclusions. It is possible that this effect may be present. It is possible that these things are present. It is possible this and it's possible that, but the research isn't there. And in fact, on a clinical standpoint, and you will see this over and over again with many drugs that physicians use, is that there will be concerns or things that are brought up in the, take any drug insert from any drug, and you will see a list of potential side effects that are this long. Well, if those were the predominant effects of that drug, we wouldn't prescribe any prescriptions for anything ever. The fact is that these are theoretical concerns for most patients, and what they require is a physician oversight, careful weighing of risks and benefits. What are the risks here? What are the benefits here? I have a patient here who's wasting away, you can't eat anything, and I say, maybe marijuana would help you, and you want to talk about the potential effect of some respiratory difficulty of 20 years of smoking over the next 20 years of his life. I don't think that's a legitimate risk-benefit ratio. Okay, and those are the things that are ignored in the statements that you make. We are making acute risk-benefit decisions on each and every patient. And while each of those things may be a concern to us, that somebody who has emphysema and lung disease, smoking anything may be a bad thing for them. And I may tell them to stay away from chemical fumes and things that are irritating to the respiratory tract in all phases. That doesn't apply to everybody. And there are alternative means of taking medical marijuana besides smoking it that may be applicable for those people. And again, what I'm asking here is that you consider this bill so that we can move this out of politics and into science, because I think physicians in general are smart enough to weigh those risks and benefits in each and every case and make reasonable recommendations, and that is simply not happening today. We have people going on the streets and dealing with the black market, subjecting themselves to legal issues and not getting good medical information. And I believe that's what this bill is about. Thank you.
Doctor, I want to thank you so much for the testimony.